There we go.
I thought that would hurt, but it doesn't.
Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now, two things. One, you and your husband, you drove all the way up from New York?
Oh, from South Carolina, Rock Hill, South Carolina.
Oh, from Rock Hill, South Carolina. Okay.
I'm just from New York.
You're from New York.
Yes.
Okay. Well, okay, so from Rock Hill, still actually a decent drive to come here with that.
Yes.
Now, also, you are 25 weeks pregnant?
Yes, correct.
Congratulations.
Thank you.
So, now, granted, what she was telling me beforehand, a lot of the pains and back spasms she's experiencing are not actually related to the pregnancy. You've had this currently
Yes.
before the pregnancy,
Yes,
anyways.
correct.
So now the main things that we're going to be focusing on, or your main chief complaints, are upper back pain, middle back pain, and lower back pain.
Yes.
And now, in the lower back, it doesn't travel down into the legs, correct?
No, it doesn't.
Okay,
Correct.
it's just staying right in through.
Yes, in that area.
Okay. And then I also saw you are a student as well.
Yes.
Okay. So student. What are you studying?
To become a dental hygienist.
Oh, nice, nice. Okay. All right. So yeah, even with that being in the classroom, I just know the posture, carrying books around, laptops, computers, reading. I mean, gee, like I remember what it was like being in school.
Yes.
Awful times, but you've got to get through it. You got to fight through it. But it does definitely take a toll on your body.
Yes.
So yeah, I definitely understand. And I do actually feel quite a bit of knots, even just with feeling from here on the back. So today that she is 25 weeks pregnant, we're going to do things a little bit differently. I'm not going to have her actually lay face down, just because, that she is that far along. I don't want to put any extra pressure on her stomach or uterus, anything like that. So we will be doing all the adjustments from either sitting, lying on your back, or lying on your side, okay?
Okay.
So first, what I'm going to have you do, I'm going to have you stand up. I want to put you through some ranges of motion, put you through some orthopedic tests, just kind of get a baseline and see where you're at.
Okay.
If you were to look all the way up at the ceiling, any pain with that?
No.
Look all the way down to the ground, any issue there?
No.
If you were to look over either shoulder, any pains with that?
No.
Okay, and then if you were to bring your ear to either side, any pain with doing that?
No.
Okay. If you were to bend down at the waist, any issues with that?
No.
If you were to come back like this, any pain with that?
No.
If you were to lean, go to the side or the other side, any issues with that?
No.
No. Or if you were to rotate over either side?
No.
No. Okay, good. So no radiating, no shooting pains, anything like that. Take a seat for me. All right, sit up nice and straight. So what I'm going to do, I'm going to push straight down on the top of your head here. Any pain when doing that?
No.
Good. I'm going to turn you to the side. Any pain with that?
No.
Good. And then to this side. Any pain with that?
No.
Okay, good. So just a lot of it is more stress, tension, just all right through the traps going down. Okay.
Yes.
Yep, that is very common. It is not normal, but it is very common.
Okay.
Those two things a lot of people don't realize. They always think that, oh, neck pain, back pain, like, yeah, it's normal. Like, no, not everybody has neck pain. Not everybody has back pain. That isn't normal. Granted, yes, it can be common, but those are two different things. What I want you to do, I want you to lay on your back for me.
Okay.
So I'm going to raise one leg up at a time. Let me know if you have any pain with this.
Okay.
So we're going to start with this side. When I raise this leg up, any pain in the low back hips? Nope. If I bend this foot forward, any pain with that?
I mean, I feel the
Tight hamstring or
yes,
calves?
but not
Okay.
pain.
I'm going to bend this knee. We're going to cross over just like that. Now I'm going to push down just like this. Any pain in the low back of the hips?
No.
Good. We're going to do the same thing on this side.
Okay.
Going to raise that leg up. Any pain there?
No pain.
Good. Bend that foot. No pain. Good. Going to bend the knee. Just like that. Any pain there?
No pain.
Good. Okay. So, let's have you sit up.
you.
And then you can face that way. So, good thing is we're not really getting, positive pain, anything excruciating, which is a good thing.
Okay.
It's more of like how you were telling me, you're getting those spasms, and they don't happen daily or anything like that. How frequent are the spasms?
So, like I was saying before, like when I got out the military, I've been out for 2 years now, and it happens every January. I think it's because of a lot of holiday driving back and forth.
Correct.
So maybe that's the cause of it.
Okay. All right. So what we're gonna do, I'm gonna scan your body while you're sitting, just because I don't want you to be laying face down.
Okay.
So I'll be doing more of a manual palpation as I'm feeling in. I'm gonna be feeling for any tight, taut muscles, looking at that shoulder height, looking to see if any head tilts, anything like that. And then we're gonna go ahead. We're gonna use the massage device just to relax any of the taut fibers. I know I already feel a ton right across through here, so we're gonna relax all of this and go on down through here. Okay?
Okay.
Perfect. So here we go. As we come in, let me know. Is there any pain in the neck when I push in?
No.
Good. And we're coming down. We're following the traps here. Now, granted, I feel a ton of knots. I know even just pushing it, I know it's not the most comfortable. And it's even, like, I'm not pushing that hard. But I'm going to, how does that feel when I do
it? It doesn't feel terrible.
Okay. But it's, yeah, you probably notice it.
I could feel it, but it doesn't feel horrible, no.
Okay. Alright, so we went from that cervical spine. We're going through the thoracic spine. We're going to make our way down. Okay. Now from the thoracic, we're going into that lumbar spine. Any pain, anything down through here?
No pain.
Okay. Any pain over that right SI joint?
No.
Directly over the sacrum?
No.
In the left side?
No.
Good. Okay. That is a good thing, because a lot of times pregnant women start to get sciatic type pain. Especially in the later weeks. I know you are already 25 weeks, but you still definitely have a little bit more time to brew. Alright, so what I want to do though, especially for you, one, just because you were saying every January you'd always get a lot of pain, so one, we don't want that to happen. This is actually the 1st of December, so she's a month away from all of this, and definitely want to keep you out of that pain. So what we're going to do, we're going to make sure and have the spine nice and aligned straight, so you won't have that issue this year, okay?
Okay.
Alright, so what we're going to do, because we're not going to be doing any adjustments face down, we're going to be doing everything either in the sitting position as you are, on your back, or on the side.
Okay.
So we're going to start from the neck and then make our way down, okay? So from here, what I like to feel for is I'm feeling like the lateral flexion. I like to feel how the vertebrae, how they glide over each other. And so as I'm going through, you tell how I'm going, like dropping down on each different level. And I'm just feeling if I notice anything sticking between the different vertebrae here. There we go. Good. We're going to come around to the other side. Good. There we go.
I thought that would hurt, but it doesn't.
No, not at all. Yeah, got a lot of movement with that there.
Okay.
Yeah, open that up real nice. Good. Okay. So this next one, I want you to stand up for me.
Okay.
And I'm going to have you stand in front, right there. Let me see. Take one more step forward. Perfect, right there. I'm going to have you put your arms out by your side. Yep. Let me go under first. Put your hands over mine. Good. I'm going to lean you back onto me. And squeeze your elbows together. More. Squeeze. There we go. You felt how that just released all that? Good. Alright, I'm going to have you take a seat, but I want you to do, I want one leg on one side of the table, one leg on the other.
Okay.
Perfect. So now with this, this will help in that that lower thoracic spine and that upper lumbar, because I know you were having some issues like right in through here with some spasming. So that'll help really clear out some of these issues in here.
Okay.
So what I'm gonna have you do? Yep, just like that. Good.
Okay.
I'm gonna rotate you over to this side. Now with your thighs, just kind of keep them to the table and look as far as you can over this shoulder, that left shoulder for me.
Okay.
Good. We're gonna relax. We're gonna turn you this way. Yeah, I'm already feeling this one. There it was. How'd that feel?
It felt good.
Good. Okay. There we go. Getting a lot of really good movement for you.
That's good.
Okay. Alright, so with this next one, what I'm going to have you do, lay on your back for me first.
Okay.
Good. So as she lays on her back, kind of take a look. As you guys can already tell, well, legs now are balanced. Very good there, which is a good thing. I'm going to have you sit up. I just wanted to check that.
Okay.
I'm going to have you, actually I'm going to have you slide on forward for me, feet facing that way. Okay, so what I'm going to do, I want to make sure that I fully cleared out the thoracic spine. I also want to help kind of relax all the muscles through here, just because after we clear out the rest of the thoracic, we're going to do that Y strap. So before we do the Y strap, I just want to make sure that everything is nice and cleared out, that all those taut fibers are getting relaxed, getting loosened up. I want this the adjustment to hold longer. So when the muscles are relaxed, the adjustment can hold longer here. Okay. Just gonna bring your hair up and over. There we go.
That is pretty strong.
It really is. This device is actually quite strong. It's almost you wouldn't think that just with the size of this, but yeah, no, it packs a pretty good punch to it. I'm gonna have you take this arm and put it behind the small of your back. Perfect, just like that. Now, as you can feel when I had you do that, it opens up that scapula. It takes. You feel how that is? So now I can take this around that scapula and get a little bit underneath through here. Okay, I'm gonna have you switch arms. Perfect. You can relax.
Okay. I need that at home.
I know, this thing, it really does work great. Yeah, and you see, that's why I like using it. It just, people's muscles and ligaments, it happens. You get stressed out. I know, with being a student, geez, you're up. Constant stress, I could only imagine.
Yes.
But yeah, that really does help. I mean, and that little thing is actually very powerful. Alright, so we're going to do what's called an anterior thoracic adjustment.
Okay.
So I'm going to have you cross just like that and like that. So I'm going to have you take a deep breath in I'm gonna bring you down and exhale out for me. There it was, and relax right there. So you felt that was the last little bit in that thoracic spine here.
Yes.
So now what we're gonna do, we're gonna do the Y strap. You can relax your arms. Actually, I'm gonna need your help.
Okay.
You've got a lot of hair.
Okay.
So if you can help me, I'm gonna just go over. And then if you can pull that through for me.
Okay.
Perfect, thank you. Okay. So now,
You know, I can get this today. I'm excited.
of course. Yeah, so we're gonna, that Y strap, I know you've seen me do this multiple times, which is why many people come here for the Y strap.
Yes.
But yeah, this is that nice, it's that powerful decompression. You'll feel this all the way up in that occiput. And you'll feel that go all the way down.
Okay.
There we go.
Oh my god.
And if you want to pull that,
Okay.
perfect. And relax there for a moment. I'm gonna have you come on up.
Okay.
How did that feel with that Y strap?
I definitely felt like the
That,
release from my back, like all of the my spine.
you felt that go all the way down, right?
Yeah.
Pretty crazy, huh? Probably didn't think you could move like that, did
No.
you? Oh my gosh, good, good.
Yeah.
That is exactly what people come here for.
Okay.
Yeah, so what I want to do, I'm gonna just go over one more time with the hypervolt. Just
Okay.
make sure everything is nice and relaxed before you end up taking off and leaving.
Okay.
Also, just because I know that you have a lot of extra stress in your life, if we can relax those muscles a little bit more, it'll help hold that adjustment longer.
Okay.
So,
Yeah, I definitely need to learn how to relax when driving and everything, because I'm always tense with doing every activity.
that is completely okay. But yes, it is definitely something that people need to learn. So we're gonna come all the way down with this.
If you did have a device like this at home, would you be able to use it every day? Oh, okay. I didn't know if it was like safe or.
Of course, yeah.
Oh, okay.
It's basically like a powerful at-home massager.
Oh, okay.
That baby's probably like, what is going on?
I don't feel him kicking, so I don't know.
Oh, don't wake him up.
Maybe he's relaxed. He's like, yeah.
Maybe he likes that.
Do you know any devices that are like comparable to this that I could use at home or?
These ones you can get as well at home.
Oh.
So this is the Hypervolt. It's made by Hyper Ice. So with this one, these retail I think for $349.
Okay.
Yeah, you can get them right on their website. They do free shipping, everything like that.
It's worth it. It's like it's worth that price.
Oh, that's what I mean. Yeah, and
Definitely.
yeah, it would be just an at-home. Yeah, you could use it daily. The cool thing with that, obviously, you know, you can use it on your back. You can use it anywhere.
Oh,
You know, I'll do it with people. You know, like I'll run it down IT bands, hamstrings.
Oh.
You know, just anywhere anyone's having any issues, and that thing really works a lot of that muscle tension out.
Yeah.
All right, how are you feeling?
I feel good. I mean, I still feel like a little not back pain, but it's just like I think when we did the Y strap, it was like a shock to my body or something.
Everything is just yeah, we're a little confused almost. Yeah, no, that definitely happens. I mean, just because I heard it, I could only imagine how much everyone heard it, you know, at home.
Yeah.
But yeah, that it gets so much movement. Yeah, that's one thing. So what I tell patients is, especially after getting that Y strap done, what you may feel like after is as you had like a hard workout, you know, that like soreness after.
Yes.
So you may have that like tomorrow, 24 hours after,
Okay.
you may have that like soreness, like you just had a good workout, but that'll go away that following day. So typically 48 hours after, just everything will feel a lot looser. You'll you feel a little bit taller. Just everything will be a little bit more relaxed,
Perfect.
especially in your case.
Mhm.
Also, definitely drink a lot of water as well. Just because even with using that hypervolt, a lot of toxins can be released, especially with like the muscle.
Yeah.
So what we're gonna do, just make sure up the water intake.
It'll help with the soreness as well. You're not gonna get as sore.
Yeah.
Okay, that's
Yeah.
perfect.
It's kind of like after a deep tissue massage.
Yeah, just up the water intake. And yeah, relax. Be easy on yourself.
Yes, I definitely. Now I'm definitely having my husband drive.
Good. Well, perfect.
Thank you.
You're welcome. If anyone is looking to get Y strap adjustment done, please feel free to go to my website, drjosephcipriano.com. As you can tell, it is good for anyone, for a younger child, for a pregnant mother here. Yeah, it's a great adjustment, and there's no reason or no need to live with neck pains, back pains. If there are things that you can do naturally to relieve these issues, might as well try these different pathways and options that one may have. So I love that I'm able to reach so many people with this YouTube channel, and please, if anyone has any issues, just email me at drjosephcipriano at gmail.com. Go right to the website, and yes, I'd love to help you out. Have a good one, everybody.